Have you ever wondered what a naturopath does or how they differ to a conventional doctor? Well, in this video, I'm going to cover that topic with you and talk about how they work to help patients holistically. About me, I've been working over 20 years now with patients in a clinic as a naturopath. So let's get started. So what is a naturopath? A naturopath is a trained healthcare professional which focuses on prevention and uses tools such as herbs, nutrition, lifestyle, diet, and any other holistic method to create better health for the patient. Naturopaths also study anatomy and physiology, but also those other topics, cramming them in and looking at a full array of factors which will help that patient recover. There is a big focus on the root cause. So rather than treating individual symptoms that arise, such as a pill for a headache, there's a focus on what could be causing that condition from the root. How does a naturopath differ from a conventional doctor? Whereas a doctor will use surgeries or pharmaceuticals to help with a patient, a naturopath uses non-invasive natural methods to help patient conditions. Whereas a doctor might use pharmaceuticals to reduce blood pressure in a patient, for example, a naturopath will use herbs, lifestyle, stress management techniques, or similar holistic methods to reduce that blood pressure. Lastly, consult times are generally longer with a naturopath. It's usually around about 45 minutes to an hour for the initial consultation, whereas a doctor unfortunately has to keep that short, and it may only be 5, 10, 15 minutes for a consult to quickly gather the information. Now, naturopaths and doctors are not in competition with each other, quite the opposite. They are working together to treat the common goal to help the patient better. We're just using different techniques, and naturopaths are using prevention is better than cure rather than acute treatment with fast solutions that a doctor uses. Now, what to expect in a consult at Cura or any other naturopath? What's going to happen is there's going to be a pre-consult intake form which will list everything from your diet, your sleep patterns, your digestive function, everything we can gather. Even if you're suffering from something like acutely like headaches or fertility issues or autoimmunity, I want to know everything else that's going on. You might have some stress at work, or you might have some eating patterns or sleep patterns which are negatively impacting your health. Believe it or not, these are contributing to the other areas in your health. So a naturopath will gather all of this information. Through talking, hearing family, genetic predispositions, and looking at body signs such as hands, skin, hair, eyes, tongue, etc., a big picture will be gathered for what's going on in your body. Finally, at the end, you'll get a prescription of some lifestyle changes, some dietary changes, some herbs, all natural methods to help improve you to move along that path to better health. Let's recap. How does a naturopath appointment differ from a conventional medicine doctor's appointment? Well, there's a longer duration and multi-modality looking at the overall contributing factors to that patient in a naturopath consultation. Curious to know more? Visit curamedicine.com to learn more. And thank you for watching this video. Be sure to continue on to the next videos. There's interesting topics just like this one. Thanks for watching.